So this is my patient case study. So the case study I chose to do this presentation on is a patient I had come in at Foothills who basically had a Meckle's diverticulum, or that's what they were curing. That's why she came to Nuke Med. Basically, I'll kind of give a background on what that is. So Meckle's diverticulum is typically a congenital abnormality where there's an outpouching in the small intestine, which can cause pain, bleeding, and inflammation. But sometimes people are also asymptomatic. It's also important to note that this normally occurs in patients under the age of 2, and in male patients it's much more common than female. So patient history, this patient I had, she was a 47-year-old female. She came down because she basically had complaints of blood in her stool and pain in her abdomen. She had a CT scan the day before coming to Nuke Med, which showed positive for a Meckle's diverticulum, but basically the doctors wanted confirmation that it was actually this diagnosis with our Nuke Med scan, which can be a little bit more sensitive for this. Also, something weird about this case was that it was an add-on case from the emergency room, which normally a Meckle scan, I would say, typically isn't from Emerge, but this one was, so that was already kind of odd about this case. Some parameters of the study. As per site protocol, the patient was not treated with H2 blockers. Patient was NPO for over 4 hours. And then for the imaging portion, we positioned the patient supine. Images were acquired anteriorly over the abdomen. We kind of used the xiphoid and the pubis symphysis as anatomical location landmarks to basically get the best view. After we positioned her, we did a flow, 4 seconds for frame over 1 minute, and we injected 300 megabecquerels of PERT IV. After that flow, we did the dynamic imaging for 1 hour, and then a post-void static image after that. So processing and next steps, dynamic images and flow were processed and sent to the radiologist. Basically, we just wanted confirmation that they didn't want any more further imaging. So this case, the patient did have abnormal uptake in the lower left portion of her abdomen, and so we did end up doing a SPECT CT. So we basically just did SPECT CT and then she was done. Okay, so for the SPECT CT, after we did that, it was confirmed that the patient had a Meckle's. You can see in the image here, this isn't her images, but it's just an example. There was an increased area of uptake in the lower left portion of her abdomen that had the same intensity and timing of the stomach uptake, which is what the radiologist had written in the report. And so because the patient tested positive for this pathology, she was able to be sent to surgery and basically got the right treatment that she needed. So before the patient arrived, in Nuke Med, the scan isn't seen very often. It's normally something done in pediatrics, and like we say, the rule of 2s. It's normally seen in patients under the age of 2 years old, and in males. So because of this, there was a little bit of a bias that came in from some of the technologists, that it's kind of a waste of time. She's 47 years old and she's a female. It's probably not going to be positive. And so I feel like this kind of affected the way almost that the patient was interacted with. even though it turned out not to be the case, like the case was positive. Yeah, so because we did this scan, the patient was able to receive accurate quality care afterwards. So it's kind of important to limit the bias and just treat every patient equally. So moving on to evidence-based practice. So kind of give a definition. Evidence-based practice is using problem solving in a clinical setting, combining scientific evidence and clinical experience to achieve better patient outcomes. So kind of relating that to this case, you can go into best available research. So Meckle's diverticulum scans are something that have been performed in nuclear medicine for a long time. Although it's true that this pathology is most common in pediatrics, that doesn't mean adults cannot receive this diagnosis. So that being said, more research should probably be done on this pathology, specifically in adults and women, just because, there is that little bit of bias in nuclear medicine, but also, obviously this case was positive. So it's not just all pediatrics and all males who get this pathology. So I think there should be more research in this. Clinical expertise. As a nuclear medicine technologist, if the patient is having symptoms similar to Meckle's despite their age or their age, sex, that type of thing, a nuke med tech should be able to recognize whether or not the test is right for the patient. So listening to the patient's symptoms and what they're actually telling you is really important. Even doing this may lower the patient's radiation dose and also ensures that they aren't wasting their time getting scan after scan after scan. Patient values. So respecting patients' experiences and values is really important. Trusting the patient about what they're saying, about their symptoms, even though it was unlikely that the patient would have a Meckle's diverticulum, it's still important to listen to the patient's experiences, make them feel heard, make sure you're listening to their symptoms and what they're going through, because you just never know. So what questions could this case study inspire? So there's a few that I think could be looked into. So are we practicing nuclear medicine with the most up-to-date information on pathology and protocols in order to give our patients the best results? So obviously, if perhaps we had more information and more studies done on this pathology, then we might be able to do a better job and give better results for patients like this one who came in that day. How do biases affect the quality of care our patients receive? So, it's kind of, there's this bias about Meckle's that, it's only in pediatrics, only in males, and then you see this case where it's a 47-year-old female who had this diagnosis. So maybe it's important for, in all imaging modalities to really recognize our biases and how that affects the way we treat our patients, the quality of care they're receiving. We should really go into every case and every patient with a clean slate. Should more testing and clinical trials be done on all age groups and genders in order to improve upon and upgrade relevant clinical data on Meckle's diverticulum specifically? Again, so if more clinical trials are done, more research, then that would obviously impact patient care and improve our patient's experience. How can evidence-based practice improve upon patient experiences? So in general, I think using evidence-based practice every day can ensure the best quality care for our patients. In this case, instead of just going off of textbook, that, it can only happen in males under 2 and pediatrics, so this is just a waste of a time of a scan to do. Instead, listening to the patient and making her feel heard, she could have potentially received better patient care. Additionally, as an NMT, it's our job to listen to patients and decide whether or not the scan is right for them, just based off their symptoms. So, leaving bias behind, she was having blood in her stool and abdominal pain, which are both signs of a Meckle's. So just listening to that and deciding based off that, okay, this is the right scan for you, not just saying, okay, well, you don't fit the criteria, you're not under 2 years old, you're not a pediatric, so we're not doing the scan. Which obviously is not the case because she tested positive. So yeah. And then my references here, and that is it for the presentation.